Okay. Hello. Mine. Lung disorders, but as always, we will speak about briefly about normal anatomy and physiology, and then we'll discuss main disorders about lung. Uh, but always, as always, I have prepared presentation, and I have planned to have assessment of kidney chapter. So I have um, MCQ questions and true or false type of questions. First of all, but I will see. I will see if the students comes, and I will start with this part. If none of them come to live lectures, then I will decide. I will start directly to the lung chapter, and by the end of our tutorial, um, I will do that. Uh, MCQ and true or false questions. Let's wait for a few minutes. Let's wait if somebody joins us. I will repeat one more time. I know it's difficult. Life is difficult every time, um, uh, and especially it's difficult time because of this coronavirus and so. But we should fulfill our job. Uh, you are doing this pathophysiology course, so and you already had one midterm, and you got quite good marks. But we have left second midterm and final exam. Um, so it's very important now to prepare second midterm uh, and got the good marks in second midterm. Uh, and I don't think that it will be that easy for, or it will not be that easy to get high marks in second midterm. And also in final exam you need to know both of this part of the chapters, right? So actively involvement of the second part of the course, I mean the second part which involves the second midterm. So this part is also very important. Don't became, I mean, it's kind of a thing, and as and I also used to be a student here, so I know what should students think. Oh, I got high marks in first midterm, so it's okay, I will pass this subject anytime, anyway. But it's not like this. Second midterm is very important. In final exam, it combines both first midterm, second midterm, and there will be several chapters you will have to prepare at home. So I'm telling you, don't don't overestimate, or don't underestimate actually the situation, and actively involve and prepare each chapters each week. Otherwise it will be not be impossible. And I will emphasize also this second part of the course is much more clinical part, and I guess more interesting and more important also. But first one was also basic things mainly, mainly, and it's important to understand the second part, but it's very important to, and this part is clinical part. You need this knowledge um, through your clinical practice. Um, yeah, that's what I wanted to say. So I will encourage you to be actively involved, and I will tell you that second midterm, I don't think that it will be is that easier to get high mark in second midterm, and of course in a final exam. Uh, so I'll present now. Mhm. So I am presenting now. So let's wait for a few minutes and I will start. And I will start. Uh, so today we are going to speak about lung chapter. Next week we are going to speak about GI tract. And they are very high yield, very clinical topics. Without knowing those things and very practical things which is mentioned in your book, it's very difficult to become rehabilitation doctor and also nurse. Yeah. Abed mailed me, and I hope he's okay and he will manage his little things. But I don't know about Yazan. Mm, Someone was attending last tutorial. Maybe he will join us. So later today. Okay, so I will start. If somebody will join me, uh, yeah, we will continue together. Okay, so respiratory system and associated disorders. So what will be the content of today's tutorial? As always, briefly, I will speak about anatomy and physiology of the pulmonary system, disorders of the respiratory system. Yeah, the keywords will be carbon dioxide, CO2, external respiration, hypoxemia, oxygen, dyspnea, hemoglobin, hypercapnia, respiration, expiration, hypoxia, inspiration, respiratory failure. And I hope you are watching this videos later, and I'm not talking and I'm talking for a reason, at least, because just talking is not my it's not my no. But I hope you will rewatch these chapters, because I see that somehow you became less active because of this first midterm and high marks. That will not gonna work like this. I promise you. So be more active, because I really don't like that. I'm speaking to myself. So test your prior knowledge in lung chapter. Name 5 major anatomical structures of the lower respiratory tract. Yeah. So anatomical structures, respiratory tract. Pause here and name them, please. List the main function of the respiratory system. So this is very important. Why do we actually have the lung? What's the main function of the lungs, respiratory system actually at all? Very high yield, very important to have insights. Describe the process of gaseous exchange. Identify the physiological observations the nurse should use to assess a patient's respiratory status. What's the role of the healthcare professional in the care of patients experiencing breathlessness? Yeah, very important, this one. So please pause here and assess your knowledge. Uh, so yeah, of course, learning outcomes are what you will learn by the end of this chapter. So first of all, I will start about the anatomy and physiology. So respiratory tract is divided upper respiratory tract and lower respiratory tract. Upper respiratory tract starts with um, nose and uh, of course mouth, and then actually it's not a respiratory tract, pharynx and ear. Then the ear, so pharynx and nose, sorry. Then the ear goes from pharynx to the um, larynx, to the larynx, and there is also quite close to that tract is actually, I will show you here. So nose, nasal cavity, pharynx, and from pharynx it's larynx, and then there's trachea. Um, this is actually nose, pharynx, nasal cavity, oral cavity. So till the trachea, this is upper respiratory tract. Um, um, and they have very important function. Here, ear becomes more moisted, more warm because of the lots of capillaries here, and also yeah, so that's main function from the upper respiratory tract. When you're talking about lower respiratory tract, you will see it's larynx. From larynx is trachea, which contains several cartilage rings, which makes it I mean solid, because it should be because of the pressure. Um, so and also very important thing is here that from the pharynx there is a larynx enters, and there's also esophagus, right? So So in order to food, sure, I mean, food also goes through this way, mouth cavity, and then it's supposed to be goes to the esophagus, not larynx and trachea. Therefore, there is epiglottis, which covers larynx and trachea and prevents food to enter this pathway. I hope you remember all of these things from normal anatomy. So what about other parts of the lower respiratory tract? Then there is a bronchus, left main bronchus, left primary bronchus, and right primary bronchus. This is called carina, which is which is a bifurcation of the trachea. Left primary bronchus is divided then to the left secondary bronchus, left tertiary bronchus, and left bronchial. Right secondary bronchus is divided to the right primary bronchioles, right tertiary bronchioles, right bronchial. I really don't like that I'm speaking to myself and none of you are attending here. It will not work like this. I'm really upset. I don't like this. Because if you don't like this time, you can manage to make other time, but it's very important to have the interaction. Just talking me, I'm really upset. Because it will not work like this. And of course we have pleura, which covers the lung. We have visceral pleura. We have parietal pleura, visceral pleura covers itself the lung, and parietal pleura covers the thoracic cavity. And between visceral pleura and parietal pleura, there is a space between them, which is called pleural cavity. And we will speak today later about pleural disorders also. Yeah. Bronchial tree, which contains primary bronchus, secondary bronchus, tertiary bronchus, bronchioles, and terminal bronchioles. And terminal bronchioles, of course, are divided to the alveoles. And also, the primary bronchioles contains cartilage rings. Yeah. Microscopic anatomy of each lobule of the lung. But first of all, we have to mention that there are three lobes in the right right lung, and there's two lobes in the left lung. So you see here, so three lobes here and only two lobes here, because actually this is the side where the heart is found that makes it. So we have three different lobes in right lung and two lobes in left lung. And this is diaphragm. I did not mention. So yeah. So microscopic anatomy of a lobe. So we have terminal bronchiole, pulmonary arteriole, yeah, lymphatic vessels, respiratory bronchiole, alveolar duct, you see, and alveoli here, alveolar sac, visceral pleura, which covers the lung, as I told you, pulmonary capillaries, so you see lots of capillaries around the alveolar sac. This is a place where uh, 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 external respiration takes place, so exchange of the gases takes place. Yeah, so this anatomy is important to remember. So pulmonary ventilation. So main function of the lung is to uh, uh, actually its main function is ventilation, um, to make blood um, more oxygenated and less and take from the blood carbonic dioxide. So exchange of this is the main function of the lung. So ventilation is main function, but it has also other functions. So now let's start talking about ventilation. So pulmonary ventilation describes a process more commonly or known as breathing. So actually all this gas exchange process happens because of breathing. Yeah, because of I mean, it's not correctly said. Gas exchange between the alveola and alveolar capillaries takes place because of the concentration gradient of different gases. But this concentration gradient is established because of breathing. So during breathing, during inspiration and expiration, during inspiration, in, sorry, during inspiration, of course, air, atmospheric air, which is found here, goes from outside to the lung. This atmospheric air contains